Mocha is the best, it is of quality. Make it your choice, a trial will convince you. Mocha is the best, it is of quality.
I want to welcome you to another session of a Mental Mock Clinic. I am Dr. Onimedia Eldebetesim. I'm Associate Professor of Orthopedic Rehabilitation. I am the CEO of Mental Mock Clinic. This session, we are going to be demonstrating some skills of the spines in terms of examination and mobilization technique, which is a sustained posterior anterior digital pressure. You pick each of the spine. First of all, let your patient lie prone and let your patient lie his forehead on his hand, so that you can have a breathing space for him to breathe effectively. You have to look for a major landmark of the spine. As a cervical spine, the most prominent cervical vertebra is the seventh cervical vertebra. That's the most prominent. You locate that and you apply your digital pressure by counting upward or downward to identify. If you want to apply your digital pressure, for effective force, you need to superimpose your mobilizing thumb over the other. And you may have to climb up because you have to maintain a vertical pressure. And you need to be close. So when you identify your C7, which is the most prominent bone, you have to lock your elbow and make sure that you are actually using your shoulder girdle muscle to apply that pressure. So you press downward and not into the pain and ask if the patient is experiencing pain. If you're experiencing pain, you notice that there's pain on C7, then you count upward, move to C6 and apply a digital pressure on C6. Then apply a digital pressure on 5 and look if there is pain. Then on 4, that's how you count from 7 to C1. If there is pain and your X-ray, your medical imaging actually show you there is a dorsal intervertebral pain, or you have from some osteophyte which has grown in the lamina of the vertebra or within the neural canal, then you can use your Hungarian technique, which we call vertical oscillatory pressure, VOP. And you make sure that you actually use the force coming from your shoulder girdle. And you must lock your elbow joint. Then you oscillate. You have to make sure that your oscillation is rhythmic and it's of grade 1 or grade 2. Rhythmic oscillation with small amplitude and you oscillate. You have to try this severally and acquire a skill to actually apply VOP. And you need a feedback from your patient by asking him whether the pain is actually going down or the pain is increasing or still the same thing. If the pain is not decreasing or the pain is increasing, it is either that your vertical oscillatory pressure is not indicated or your oscillation is not rhythmic and it's not of grade 1 or grade 2. So you have to adjust your oscillation and ensure that it is rhythmic. And you have the feedback that the pain is going down with your oscillation.